I'm Dr. Rita Bakshi, Chairperson of International Fertility Center, talking of treatment and diagnosis of female infertility. Let me talk of how do we diagnose whether everything is normal with a woman when she is trying to conceive. As we all know, the definition of infertility is when a man and a woman are staying together for 1 year, not using any protection whatsoever, and then if they do not conceive, then we start looking at them and try to find the cause for infertility. But if a woman is more than 35 years, 6 months of unprotected intercourse is enough for her to seek a doctor's advice why she is not getting pregnant. As I said, age is a very, very important factor. As you grow in age, that means you become 30 and above, 35 and above, please have your antennae going up, because that is the time when you really should be working really, really hard to get pregnant. And what do we do? How do we diagnose whether everything is normal with the woman or not? Now, the most recent tests that we are doing are hormonal testing. If we do a day 2, that means if we count first we look at her cycles. Are they normal? Are they regular cycles? If a woman is having a 28-30 day a normal cycle, more or less it means she's alright. That means her hormonal pattern more or less is alright, but may not be so also. So it is important to do not on the first day of the menses, but on the second day of the menses, or on the third day of the menses, she can undergo a hormonal testing. FSH, that's a hormone which is released from the pituitary to form good eggs. LH, estradiol, thyroid and prolactin. These are the hormones we test on the second or the third day of the menses to make sure that they are all in the normal range. Also, a very new test is of serum anti-Mullerian hormone, or AMH. This is a test of the ovarian reserve of a woman. If it is very low, we know that means the amount and the quality of eggs is not good enough, so we really have to work very hard. If it is very high, we know she is probably a polycystic ovary, and we have again to do some work. So it is important to, so if it is between 2 and 4.5, we know it's a satisfactory fertility, an optimal fertility, and we can take our time when we are trying to make her conceive. These are all blood tests. So all she has to do a day 2 testing to know, whether all her blood tests are normal or not. A day 2 ultrasound will also reveal the antral follicle count. So that means the follicles are what we call eggs. So you can do a second day ultrasound on the second day of menses to see how many number of eggs are there in her ovaries. What is called the antral follicle count. So if her antral follicle count is good, that means she has about 8 to 10 eggs in both her ovaries. That means again it's a good antral follicle count. What else can we do? Now we have seen the ovarian reserve for the woman. Now we have to see whether her tubes are open or not. We do a simple hysterosalpingogram, or HSG. This is done on day 9 or day 10 of the cycle, when a dye is injected from the cervix from below and an X-ray is taken from above. Both the ends of the tubes should be open. That means the dye should go from the cornual end, come out from the fibral end, and the spill can be seen on both sides. We know her tubes are good and open. Sometimes you will find the tubes are blocked. Now that can be maybe an iatrogenic, maybe the doer didn't do it properly. So then we have to reconfirm it by doing a laparoscopy. By putting in a laparoscope, that means by putting in a minimal 1 stitch through the umbilicus, a laparoscope is put in, and you see with your own eyes. When the dye is put from below, can you see the dye coming out from both the tubes or not? So which is again a diagnostic test to make sure that the tubes are good and open. A laparoscopy will also reveal whether there are any adhesions in the abdomen or not. Is the anatomy of the tube looking all right or not? Is the ovary looking healthy or not? If you can see a lot of cysts on the ovary, you can even do a puncture of those cysts while you put in a laparoscope. Also, you can see whether there is endometriosis or not. Any endometriotic blue colored spots in the abdomen, all over the uterus, all over the ovaries, or the tubes can be seen, and you know that this is what will cause scarring later on. So a laparoscopy can be done. Also, some people are now doing a sonosalpingogram. That means instead of putting a dye, they put in air and see whether air is coming out or not. These are all tubal testing. So you tested the ovary, you've tested the tubes, now you have to test the uterus. Now a uterus can really now be looked at very nicely with an ultrasound or a 3D scan, and all the layers of the uterus can be seen very, very well on a good ultrasound. But if you want to do a detailed testing, a hysteroscopy or a scope put inside the uterus, can visualize with your own eyes, look at the cavity, look at if there are any small polyps or any small fibroids which can be removed also, any adhesion, anything else which is wrong inside the uterine cavity. So after you've done the uterus testing, you can look at the cervix and the vagina. A postcoital test, which is done after a couple has coitus, the woman comes and within 2 hours a sample is made out from her cervix, smeared on a slide and seen whether the sperms are alive or are they dead. So these are the tests which one can do for finding out what is wrong with the woman as far as her fertility status is concerned. As I said, besides hormones, besides doing an anatomical testing, a genetic testing, and an antral follicle count, and knowing her AMH will all in together reveal whether everything is normal or not. But important is also to ask in history, whether they are having any coital issues. Vaginismus is very common in women. So there are women who would not let a good penetration happen. This can be an important cause of infertility also. So it's important to take a good history, make sure that there is no vaginismus, there is nothing wrong as far as the coital technique is concerned, and then go about treating the woman. In case you have any problems regarding this topic or diagnosing of female infertility, you are welcome to contact me on my details given below in the box. Thank you.